I'm Wayne Sharp, Health Media Specialist with the Internews Rooted in Trust project. And Internews is one member of the group hosting this dialogue, the Media Task Force of the Eastern and Southern Africa Interagency Working Group for Risk Communication and Community Engagement. My co-moderator today is Tole Nyata. Tole is an Internews pandemic media mentor based in Nairobi. The Centers for Disease Control and Prevention reports there is no evidence that COVID-19 vaccines cause any problems with becoming pregnant, and there is also no evidence that vaccines cause male fertility problems. But despite these facts, rumors about the impact of COVID-19 vaccines on pregnancies, on virility, and on the risks on breastfeeding after getting vaccinated have persisted in the East and Southern Africa region. To address these issues, we will be joined by the WHO's Dr. Atuhebwe and Internews' Dr. Jaya Shreedhar to give us the facts on COVID vaccines and reproductive health, and give advice to you, the journalists, on how to handle these issues in your coverage of the continuing COVID pandemic. Our goal of these dialogues, as always, is to provide you, the journalist, with news you can use in serving your audience. We want to make sure you get the answers you need to the questions you have so that you can inform your readers, listeners, and viewers. So please feel free to type any question you have in the Zoom chat box during this dialogue, and we'll put them to our experts today. Let's get right into this. I'd like to welcome Dr. Atuhebwe to the dialogue. Dr. Atuhebwe is a medical doctor, public health expert, and advisor. He has a track record of driving health system reforms and has pioneered the implementation of immunization and disease control initiatives. He works with the WHO Regional Office for Africa, where he leads the COVID-19 vaccine introduction and the immunization program for West Africa. He is skilled on immunization, reproductive health, policy analysis, strategic planning, research, and public health. Dr. Atuhebwe, welcome to the Media Dialogue.
Thank you very much, Wayne. It's such a pleasure to be here, and thanks for the opportunity to be on set with you. Thank you.
So the floor is yours. Tell us what you have to say.
So first of all, Wayne, do I come in?
Yes, please. Yes, please. The floor is yours.
Thank you. And thank you again, Wayne. And thanks, thank you, viewers, for joining us today on this very important discussion. I'm very thrilled to be here to speak with you about some of the concerns you have surrounding the safety of the COVID-19 vaccines. We recognize that there is widespread misinformation circulating about COVID-19 vaccines and infertility. And one of the reasons why we're here is to assure you that there is absolutely no scientific evidence that these vaccines are harmful to the reproductive system. And this includes men and women. Even if there are temporary changes in one's menstrual cycle, it's important to understand that these changes are common and are for different reasons, but they wouldn't cause infertility. These claims are not new. They didn't start with COVID-19, neither did they start with the COVID-19 vaccines, and continue to remain false. And when you hear things like this as viewers, one of the things we want you to look at is the fact. It's important to be able to ask yourself, what is the fact? And the fact is that there is no authorized vaccine that causes infertility. And the reason is because vaccines are carefully tested to check their safety and efficacy before being approved. Another important question you may want to ask is it safe to take the vaccine while pregnant? Is that something that should be of concern? It is safe to take the vaccine while pregnant. Pregnant women who are vaccinated can pass the antibodies through the umbilical cord. thereby offering protection to their baby. They also face a higher risk of severe illness from COVID-19. And as a result of this, we advise them to take the vaccine to protect themselves and their unborn babies. You don't need to delay until you have given birth. We encourage health workers to help them understand the risk and also help you to make this informed decision. And of course, if you have any concerns, the first port of call is your primary healthcare facility or the medical center you go to, where there would be a doctor that can offer you evidence-based guidance based on medical literature. Another point to really discuss, Wayne, in line with this is in terms of impairment in fertility, particularly those who are on fertility treatment. And we're asking that if you're on a fertility treatment, please talk to your physician before taking the vaccine. In this particular case, there is no evidence or reason to suspect that the vaccine could impair, your fertility. In the line of our work, one of the concerns that also come up, particularly with women of reproductive age, childbearing age, also has to do with breastfeeding. So there are also lots of questions around breastfeeding mothers. Can breastfeeding mothers take the COVID-19 vaccines? Is it life-threatening to the baby or to the mother? And like I mentioned before, the antibodies produced by breastfeeding mothers can be transferred through breast milk to provide protection to their infants. So the vaccines are safe for breastfeeding mothers. Providing COVID-19 vaccine to pregnant and breastfeeding mothers from the start does not have any harmful effect. Initially, at the very beginning, there was some lack of clarity with regards to the effect of vaccines on pregnant and breastfeeding mothers, because they were what we classify as vulnerable population. It was agreed that there was a need for further testing of the vaccines to confirm its safety. But we are way beyond that now. There is a lot of evidence now that show that breastfeeding mothers can also take the COVID-19 vaccine, and it is not harmful in any way. The COVID-19 vaccines, just like any other vaccines, work by enabling our bodies to develop antibodies to fight against the virus that causes COVID-19 and prevents you from severe illness or even death. And this is very important, Wayne, because oftentimes people think, why should I take the vaccine when I don't feel sick? You should take the vaccine because it is important to not just protect yourself, but also your community and loved ones, people around you from severe illness and also from being sick. With regards to what we're discussing today regarding the effect of the media, misinformation, and unconfirmed news, we would like to advise that you always confirm the source of your news before sharing. And the WHO has a repository of information, on the website. There are tons of resources and literature, just to guide you and provide you the evidence that you need. Again, don't be driven by baseless rumors and misconceptions. The vaccine remains free, it is safe, and it is effective. The only way to go back to the normal way of living is by getting vaccinated. And remember, as viewers, we are protected together. It is not over until it is over. And I'd like to thank you again for the opportunity to share some of these thoughts, with our audience. And I'll stand by for some of the comments that they may have. Over from my end.
Thank you very much, Dr. Atuhebwe. Maybe we can go to one or two questions. Tole, do you have a couple of questions you want to share with Dr. Oni?
Yes, I do. So we have a number of questions. Some of them, as you'd expect, have been answered so far by the presentation. But here we go. We have John from Ghana Health Services, who asks, how do we get women and girls to come for reproductive health services? And then we have Mike Mwaniki from Medical Media Services Limited, who asks what is the best way to report on the widespread but falsehood belief that COVID-19 vaccine causes infertility amongst men? I think that would be Jaya. That question can be for you. So we have also a similar question from Emmanuel from Uganda's Unity FM with regards to how to report this falsehood about the fertility rate. We can take those ones for this round, and I'll give you more as we proceed. Thank you.
Wayne, do you want me to go first?
Please, yes. You can answer whatever question you want there.
Okay. Thanks, Tole, for these very pertinent questions. They're very important, and it's actually very critical that when we have questions, that we have the right channels to ask them, and this is one of them. So in terms of women of reproductive age, the first question was, how do we get them to come for reproductive health services? And you know, it's all about advocacy and engagement. You know, it's about recognizing that we all are influencers, you know, one way or the other, and wherever we have the opportunity, we should pass across that information. And if there are areas where there is no clarity, wherever country you are in, there are institutions that you can go to that can share advice or health services that are available in the facilities that are close by you. Yeah.
Okay, thank you. We'll come back to questions in a bit. I just wanted to move over now to talk to Sylvia Samariva of UNICEF. You know, off the top of this show, I was talking about misconceptions, and Dr. Efe Luta mentioned that we really have to confirm our news sources when we get our information about COVID-19. UNICEF and others do this really great service where they analyze social media to find out what are the current trends in what people are thinking, what information and misinformation they are sharing. And Sylvia, you're joining us now. Welcome, and you're going to show us some of the latest results you have with some social listening insights on reproductive health and COVID-19 vaccines. Welcome to the dialogues.
Thank you, Wayne. Thank you so much for having me. Yes, I would be happy to share some of our recent monitoring on reproductive health issues. I am not sure if I can share my screen. Would you be able to share the presentation?
I believe, Christoph, do you have the presentation now? Can you put those on the screen?
She's able to share.
Should be in, yeah, should be in your email.
I can see that I can share my screen now. Thank you for enabling that. I'll just share directly if that's okay.
Yeah, okay. Yes. That's okay. Please go ahead.
Go ahead. Just because I think this type of analysis is easier to see visually. than just sort of with me explaining it. But yes, we have been, as Wayne mentioned, we have been doing some monitoring, digital social listening, we call it, mainly social media and digital news monitoring around COVID-19, and particularly in this case, reproductive health issues. And we focus on Eastern and Southern Africa countries. So this is part of the UNICEF ESAR monitoring. We also collaborate with partners that are part of the African Epidemic Response Alliance on these monitorings. So this is mainly what we have been monitoring, just to give you some context, is related to public social media posts, the digital news articles. So there is a lot more we know that goes on in other channels that have also been mentioned, dark social medias, for example, of course, a community level. So this may just be a partial view of what we can observe by monitoring online platforms. But what we have seen is that overall, the content that mentions reproductive health concerns or issues around COVID-19 vaccines is typically representing between 2 and 50% of overall engagement on COVID vaccines. You can see in the graph at the bottom, it's sort of a trend for the past 12 months. And in purple, you can see the engagement generated by content that mentioned pregnancy or fertility concerns. So it is sort of a part of the overall COVID vaccine conversation. So I'm not going to dive deep into this slide, but I wanted to show the trend just for reproductive health filters. So what is that around COVID vaccine is being discussed that particularly refers to fertility concerns or COVID vaccination during pregnancy. And I'm going to dive deep into 3 macro narratives that we have been analyzing that were also mentioned both by the previous speakers and in the comments. The first one is on vaccine safety for pregnant and breastfeeding women. So of course, we have seen several claims that have been going around on social media, on digital news around this. And I just pulled some examples, but of course we have seen concerns related to miscarriage and fetal abnormalities in vaccinated mothers, as well as concerns for the health of the expectant mother. A lot of this goes back to the claims that the vaccine has not been tested long enough, that there isn't enough clinical trial data around this subpopulation, and sort of the larger conversation and larger misinformation around the experimental vaccine claims that we have seen applied to other subgroups as well. There is also some concerns that we've been tracking related to whether vaccine side effects are passed through breast milk to babies. So sort of like a vaccine shedding claim, but specific to breastfeeding that can really impact, the decision of mothers to breastfeed and concerns that they may have at a very fragile moment in their life. So in terms of our recommendations around this, we think it's important to share humanitarian stories of mothers who did get the vaccine and had a positive experience with their decision, as well as, of course, the importance of amplifying responses and debunking to some of these rumors, particularly at moments where they are generating high engagement or where they are most prevalent. And that is sort of part of the reason why we really try to track reach and engagement to understand the extent to which these rumors are reaching a wide audience. Sorry. The second macro trend is related to fertility in men and women, and this was mentioned earlier as well. We see a lot of comments related to this, mainly boiling down to the concern that the COVID vaccination is going to impact fertility and birth rates in the future, and also a lot of concerns related to children and sort of claims that the vaccine can impact future fertility for young children and young women specifically. So here our recommendations are very focused on monitoring closely, sharing relevant content to answer questions, particularly getting ahead of the curve, picking up on data voids to try to respond as soon as possible, as well as trying to build that resilience against misinformations with users and readers. So encouraging them to be skeptical of the content that they see on social media, pay attention to the source of the claims. This was mentioned earlier too, so that they can also sort of avoid falling for misinformation, even if they haven't seen the debunk or the fact check to that particular claim. And also, of course, providing spaces like this one where questions can be asked to medical professionals when there is a health-related concern. We're also closely monitoring these conversations because we are concerned about spillover on conversations and demand for other vaccines. Thinking, for example, recently there were some claims, old claims going around on the Tdap vaccine in Kenya. So we want to be very on top of this and make sure that we are not seeing narratives affecting other vaccinations, particularly routine vaccines for children as well. And then the last sort of macro narrative that I wanted to underline is related to menstrual health. Of course, a lot of the concerns that we have seen have been related to this. Users are reporting their own experience with either irregular menstrual cycles after the vaccine or excessive bleeding. So they are sharing their valid concerns. And we have seen also a lot of engagement around studies that are being published in the past few months and that are being reported by local news media. For example, one of the peaks that you saw in the previous graph was related to a study that was published in January that suggested that there can be a slight and temporary delay in menstruation. And this generated a lot of engagement, and a lot of people felt that their experience was validated by the results of the study. So we think, of course, it's important to provide these spaces for safe discussion online and offline, to ask questions, share their experience and get information so that users and women particularly can make decisions around vaccination that is informed. And also making sure that when they're reporting, there is reporting on these type of studies, often the findings are preliminary. There are, of course, limitations to the studies, making sure that digital content can capture some of the nuance to the extent that it is possible, and really amplify the voices of healthcare workers and experts that can really discuss risk and benefits in a way that is informed by the recent evidence. So I think these were sort of some of a quick overview of what we have been tracking. I think a lot of it resonates with what has been shared earlier, and I'm happy, of course, to answer any questions or share more. Here's my contact email if you want to reach out on this. Over to you, Wayne.
Thank you very much, Sylvia. I think what we'll do is we'll hold questions for now, and we'll hear from our third speaker, and then we'll open the floor for questions for any of our three speakers today. Now I'd like to introduce Dr. Jaya Shreedhar. Dr. Shreedhar is a health and development journalist and medical doctor based in Chennai, India. She's also a pandemic media mentor with Internews. She consults for groups such as WHO and UNICEF and teaches public health journalism at the Asian College of Journalism. Today, Dr. Jaya will talk to us about ways we as journalists can approach covering the information and misinformation surrounding COVID-19 vaccines and reproductive health. Dr. Jaya, welcome to the Media Dialogue.
Thank you, Wayne, and such a pleasure to be on this panel with my colleagues, dear colleagues Tole and Christoph, as well as Dr. Oni and Sylvia. Such a pleasure to listen to you both. I was just thinking that picking up from where Sylvia left off, we'd like to share some rumors from Zimbabwe and Sudan about the impact of COVID-19 vaccines on reproductive health. And these sort of expand. I mean, these are from the ground up rumors that we've picked up through social listening, tracking the rumors on Facebook and social media platforms, as well as through direct listening with community groups. So they're a collection of rumors. But before that, I wanted to pick up on something that Dr. Oni was talking about, which is saying that there's sufficient evidence to show that COVID-19 vaccines are safe to give to pregnant women and that they don't have an adverse impact on pregnancy, childbirth, or the future health of the child. So it's easy to state this fact to audiences, But when we're countering these rumors, we need to keep in mind that not only do we need to engage with our audiences in terms of providing them scientifically accurate data and evidence, we also need to be able to engage with the fears, their cultural beliefs, or their state of mind at that time. Because oftentimes people circulate these rumors or believe in them because of who gives them that information. So it's a question of trust. If somebody's mom or grandmom, aunt, or a neighborhood physician or a traditional healer tells you that vaccination can cause impotence in men, then there's a greater chance of the person believing that rumor. So the source of the information becomes a really key factor. And that is more important than ever in journalism on this topic and all other topics. As Dr. Oni was saying, we need to reach out to authentic sources. So Christoph, the next slide, please. I was just wanting to say that we do know that rather than COVID-19 vaccines having any kind of these deleterious effects on pregnancy, for instance, the opposite is true. If you don't get vaccinated, and if you contract the infection and you develop a more severe form of COVID-19, which is what is likely to happen if you remain unvaccinated, then you have all sorts of impacts on your reproductive system. If you could press enter, Christoph, I think that there's a visual that might come up. Here you go. So don't worry about the image. This is just to show you that pregnant women who remain unvaccinated have a greater chance of, and who live in areas of high community transmission of SARS-CoV-2 are likely to develop a more severe form of COVID-19 if they contract the infection. So then what happens? They're more likely to need hospitalization. They might need attention in a critical care unit. They might need assisted ventilation. And the childbirth may be a preterm birth. They might go in for a quicker delivery before the due date and produce a premature child. And the child will have to the child might require critical care in the newborn specialized facility in a hospital called the neonatal ward or the newborn care ward. So this is a bunch of complications that might occur by not taking the vaccine. So this is good data and good information to give to people who are hesitant about taking the vaccine when they're pregnant. Help them weigh the risks versus the benefits of taking the vaccine over not taking the vaccine if you're planning to have a baby or if you're pregnant. So I think that this is really key. And in order to be able to convince the audiences, convince your media audiences that, yes, why should I believe you? You're telling me that COVID-19 vaccines are safe to take during pregnancy, and you're telling me it's going to be worse if I get COVID-19, but why should I believe you? But then you can sort of lead them through the data in a very gentle way. So the first piece of information that you might want to share with them is it's true that pregnant women were not included in the initial clinical trials of vaccines because pregnant women ethically cannot be included in those trials, but vaccines have been tested for safety among animals. So the animal studies have been done, the DART trials have been done, and there's absolutely no harmful effects of COVID-19 vaccines that have been detected on pregnant animals or the babies that they deliver. Second is that many countries that have been vaccinating pregnant women since 2021, I mean, now the numbers are running into millions, right, all over the world. So we have enough of a body of evidence from pregnant women who've been vaccinated over the last nearly 2 years and who are being systematically followed up and monitored by governments. If you look at the USA, for instance, over 198,000 women were monitored. Pregnant women were monitored as of February 2002, and not a single adverse event or bad effect on the health of the mother or the baby has been found. Similarly, the UK has been tracking more than 100,000 women and absolutely healthy deliveries. The women remain safe. Brazil has given a number of about 1 million cases as of February 2002 of pregnant women who've been vaccinated and have delivered very healthy babies. And in India, you have about 120,000, which is an undercount, but the number is as of February. So this is something else we can share with our audiences, solid, substantial, large pieces of data to show that people care. Governments are following up. The WHO is doing its job. WHO doesn't sit in a room and trot out its recommendations. The recommendations are done through very, very careful sifting of data and evidence that comes in by governments and countries all over the world that are carefully collated and very, very systematically analyzed before a recommendation is made. And the other thing is that it's important to point out to people that irrespective of which COVID-19 vaccine has been given to pregnant women or men in the reproductive age group, these safety data are pretty uniform across every type of vaccine. Whether it's the mRNA or whether you're taking the AstraZeneca vaccine or the Pfizer-BioNTech vaccine, it's pretty same. And some audiences who've been reading up about vaccines might want to know, but they are using these viral vector vaccines, right? So they're hitching the vaccine onto another organism and putting that into the body. So what if that other organism, the vector, affects my baby? Well, there's absolutely no evidence to show that the vector affects the health of the pregnant woman or the child or the man in the reproductive age group. And remember that we can also show them evidence, also give them evidence that these viral vector vaccines have been used very successfully during the Ebola campaign as well. So I think it's important for journalists to read up, go to the peer-reviewed literature, try and look up the studies on the Google Scholar, and as well as, go to the WHO website. You will find references to several studies there, and stay updated so that it's possible for you to pick up data from good, high-quality peer-reviewed literature and share that with people. The other thing that, if you can go on to the next slide, Christoph, you can look up a local context in your country in order to sort of rev up the strength of your article, right? You will use slightly stronger language if you are in a country where vaccination rates are below 40%, like it is in most countries of the Eastern and Southern African region, where people who are fully vaccinated, it's around about 39% on average, right? So these are places where community transmission is likely to continue unabated because you have more than half the population not vaccinated, which means your exposure to the virus is greater. And after infection, you have greater chances of developing severe COVID-19 if you're not vaccinated, right? And that has an adverse effect on pregnancy. So it's important for journalists to recognize the context from which they're reporting. So talk about transmission levels, talk about vaccination coverage, pull up that data from your country website. And here's another great data website that I'd like to point you to. This is run by the Johns Hopkins University in the United States. And this is a sort of a dashboard of COVID-19 policies on pregnancy. So by clicking on each of these countries, you can get an idea about which government or which country recommends vaccines for everybody, or do they have certain caveats for pregnant women? Are they recommending it in the first trimester of pregnancy or later on in pregnancy? Do they recommend or not recommend breastfeeding, and so on? So as you can see, there's a patchwork of recommendations. You see these different colors. So it doesn't look like countries are all on the same page, right? So it's a good opportunity for you. If you come from a country that doesn't recommend that pregnant women breastfeed their babies, you might want to do a really hard-hitting article presenting the evidence that Dr. Oni and Sylvia mentioned here to say that that's not a good idea, right? So you need to breastfeed your baby, particularly if you live in a country where diarrheal diseases are rampant, where there are greater chances of your baby falling sick with diarrheal diseases and dying of them than if you breastfed the baby, although you were vaccinated. There's no risk of you passing on the virus to the baby. And we all need to put up front in the article that none of these vaccines contain live virus, right? So there's no risk that you might get COVID-19 from the vaccine. So it's completely safe. I just one more, I don't know if I'm going on and on, Wayne, but two more tips that I'd like to share. If I could ask Christoph to go to the next slide. Next slide, please. Next slide, Christoph. Yeah. We have to earn the trust of our audiences by not just giving the facts, but help them to critically think through their fears and cultural beliefs. And I sort of, in my conversation thus far, I've tried to sort of reason with people, right? Like giving you data, giving you access to sources of information from elsewhere, sort of converse with your audiences like you would talk to someone like a friend. And it's really important to think about one thing and keep that in our forefront of our minds when reporting about the impact of COVID-19 vaccines on people in the reproductive age group. Think of the mindset of couples who are planning a family or who are planning a second child, right? Or who are already pregnant and being asked to take the vaccine. They're in a very sensitive state of mind, highly vulnerable, and very, very concerned when they pick up these rumors from social media, or when they listen to family members or friends, or even their neighborhood doctor telling them, don't go for the vaccine. I'm not sure about it. So this causes people a lot of distress. So in the tone of your articles, we must try and avoid sensationalism as much as possible. It's not a good idea to tell a pregnant woman who is considering vaccination that, if she doesn't take it, she's definitely going to have a very difficult childbirth, and her baby will be preterm and so on. Those are the facts. Yes, we know there's a good chance that will happen. But rather than scaring them, it's important to adopt a more reassuring tone to point out the benefits of vaccination rather than its dangers, which is far more sensitive, respectful, and persuasive to people who are thinking about it. Next slide, please, Christoph. So I thought we'd share with you, quickly go through some slides of the rumors. So Sylvia, you will I think you can sort of resonate with what's going on this slide. So these are all actual statements picked up from the community. That if you vaccinate, you no longer produce children. If you get vaccinated, you become barren. Dosing is risky. You end up not conceiving, and so on. So these are a number of concerns about fertility. And as Dr. Oni pointed out, there's absolutely no evidence that this has happened. So there was actually one rumor. Christoph, can you go on to the next slide? Right. So these are things people pick up on social media, but there's also beliefs that people share, which they sort of infer for themselves based on what they're seeing in their own communities, right? So there was someone who said very few pregnancies have been recorded in my community since the emergence of this disease, meaning that these vaccines are a curse. So he actually observed what was going on around him. So how would you counter a rumor like that? By sharing population level data, right? By actually pulling up data to show that pregnancy, the number of pregnancies hasn't really gone down in any country post the COVID-19 vaccine. You can pull up pretty large volumes of data on that to say that just based on a single observation, you can't make a conclusion about it. So help them to critically think through it, right? So next slide, please, Christoph. Birth control is a huge issue. Sylvia had some of those rumors on the slide as well. Now here, what we're dealing with is like a two-headed beast, right? One is a misconception about a medical intervention like a vaccine and protection against COVID-19. And the other thing is this distrust of government or this vested interest that the vaccines are out there to control the population. And you'll find that in places like Sudan, this was like a huge concern among people belonging to the Islamic community. So here, how does a journalist engage with that? The journalist has to not, just countering this with medical information is not going to help. We have to get to the root of the beliefs and a history of population control efforts, or a history of being persecuted, or, we have to deal with tarnishing of the image of the Islamic community all over the world, that their numbers are high because they don't believe in birth control, or their numbers must expand to take over the whole world. So these are the kinds of image, discriminatory sort of perspectives about people belonging to a particular religion that are, widely propagated all over the world. And there is understandably a sort of a defensive attitude to that. So the tone of the articles have to be extra respectful and factor in that particular thing. And you really need to converse with them through this, not only by presenting the data, but also pointing out that even with other vaccines, whether it's the polio vaccine, it didn't turn male children, infertile in any part of the world. You can even pull up data from other vaccine campaigns. So here the conversation has to deal with the politics of the religion and with deep-rooted historical fears about it. And it's good to sort of pull in the views of an anthropologist or a political scientist into this, trusted voices, someone from their own community, like a mullah, or a senior Muslim scholar to sort of create greater proximity, there's more likelihood that they will trust a scholar from their own community. So these are the voices to pull into the articles. Next slide, please. I'm almost done, Wayne. So
Okay.
here, yeah, conspiracies. Yeah, we went through the conspiracies already. Then next slide, please. Next slide, please. Yeah. Anyway, so it goes on. So I just wanted to sort of summarize my main tips. So the first thing is that look up data, do our homework. We really need to do our homework, get in touch with experts who work on the front lines of reproductive health and COVID-19 vaccine. So these are the frontline health workers in the community, the obstetricians and gynecologists who meet and talk to women with these concerns, the folks in the male infertility clinics who are dealing with this, right? The religious leaders who speak to their congregations, talk to the frontline people who are actually trying to come to grips with this problem in their own communities. So authentic voices are very important. Secondly, access authentic data sources. The WHO is an excellent source of data, as is the UNICEF website, lots and lots of information on COVID-19. So seek out those things. You get simple stuff like Science in 5, which you can just copy paste into your articles, quoting and attributing the credit to the WHO, which are very easy and save you a lot of time as well. And it's very important. The third tip is to build trust in your coverage, earn the trust of the community in what you're covering about this. And the best way to do that is not to go head on with them to say that what you think is wrong, but to help them critically think through why that belief may not be supported by evidence, and pull in authentic voices from the community to bolster that argument, and adopt gentle language when you're talking to people in the reproductive age group who are on the brink of whether or not to vaccinate. Be sensitive to their concerns and avoid sensational language. So I think that I'll stop here and hand it back to Wayne, and happy to take questions as well later. Thanks.
Thank you so much, Jaya. Yeah, it's quite a challenge when we're dealing with rumors about, perhaps the medical impact of the vaccine on reproductive health. But then we go beyond that to these conspiracy theories that give us this motive. It almost seems like the bigger the rumor, bigger the lie, the more effective it is in influencing people's thinking. But it's a huge challenge to try to counteract some of this misinformation and disinformation. Yeah, let's open the floor to questions. Tole, do you have some questions that we can share with our panelists?
Yes, I do. I have a few questions for Jaya, which specific journalists asked about some specific situations. And we have like Mike Mwaniki, who said, what would be the best way to report on the widespread but falsehood belief that the vaccine causes infertility amongst men? We have something similar from Katungulu, from YGFM in Zambia, on why people still spreading the myths around COVID-19 despite all that the different agencies are doing to counter it. And there is Mabeke Beke from Public Eye, who asks, there are countries which are still recording high numbers of COVID-19 cases. Allow me to take one more. Waswa from Uganda. First is Majirata Latela asks, many people are catching flu nowadays in the country, and there's a rumor this is caused by the vaccine. As a journalist, how can I approach the story while at the same time ensuring that people understand the importance of vaccines? Let's go with that for the first round, then we'll come back. Thank you.
So is that last question addressed to me, Tole? Or yeah, I was thinking
Yes.
It's quite possible that yeah.
Both of you.
Yeah. So So people who are catching the flu are those who are vaccinated against COVID-19. So critical thinking here. I think it's important to sort of reason with the audience when countering this rumor. But first off, if you're asked as a journalist, how do you counter misinformation? I think a good thing to do is to not to repeat the misinformation in your article or make that the headline, right? So that's sometimes a headline is all that people see, or the lead of the story is all people see, and that gets sort of stuck in your head. So maybe not repeat that misinformation, but rather substitute it with a strong, positive, scientifically accurate message, such as, COVID-19 vaccines protect you from COVID-19, and, take a flu vaccine to protect yourself from seasonal flu. I mean, these are the messages that need to come out, and they will automatically flush out concerns like this, right? So it's a good idea. Can you take both vaccines? You can take both vaccines. So I'll hand it to Dr. Oni here to sort of pick up on how to space the time between the COVID-19 vaccine and the flu vaccines. But it's important, I think, for the journalists to point out the benefits of taking both these vaccines, even in one article, particularly if there's seasonal flu. So Dr. Oni, any words that you might want to add on how to space the vaccination, the flu vaccine and the COVID-19 vaccine?
Yeah, thank you very much, Jaya. I think that firstly, there's no contraindication with regards to taking both vaccines. You can follow the prescribed schedule for the flu vaccine, and also the same for the COVID-19 vaccine. And should they coincide, there is absolutely no risk involved with regards to that. Over from me.
I think there was
We
the first
still
question
have,
you shared, Tole, on male fertility.
Yes, there was that question from Mike Mwaniki, who asked how one should approach that story as a journalist. Despite that, yes, he knows it's a falsehood, but now how is he going to produce that kind of story there?
Again, don't make the piece of misinformation or the myth, like rumors abound that COVID-19 vaccines cause male infertility is not the headline we want to see, because that's like a negative reinforcement of that myth. So rather the article could be about COVID-19 vaccines and reproductive health in men overall. And but the headline could be that COVID-19 vaccines ensure safer pregnancies, or they support safer pregnancies, or take the COVID. I mean, you can't message obviously like that, but vaccinated pregnant women, vaccinated couples have greater chances of a healthier pregnancy and healthier delivery. Something like that would be a far better thing. But if certain concerns are going to be explored in the course of the article, the questions about the impact, does the COVID-19 vaccine cause impotence? At least that statement could be cast into a question, rather than it's a prevalent myth. We actually don't know how prevalent the myth is. The social media tracking mechanisms, no matter who does it, no matter how many organizations do it, don't pick up every rumor that's out there. So we don't really know which rumor is the most predominant rumor circulating in the community. This may just be something that coincidentally people picked up a lot. So we don't want to keep reinforcing that. So turning the statement into a question to COVID, is there any evidence to show that COVID-19 vaccines might have an impact on male fertility or male, erectile dysfunction? Do they have any link to erectile dysfunction at all? And then you give the evidence that absolutely none. And then you cite the scientific data. I have a paper here that I'm happy to share to show that so far there are no studies to show. So far, there's absolutely no evidence. This has been deeply studied by high quality research from many countries, and there's absolutely no evidence to show that this is the case. On the contrary, I mean, ideally, in the same article, On the contrary, if a couple that is planning pregnancy or aiming to have a good, high quality sexual life, right? Even then, through close social during sexual contact, you are breathing into each other's faces. You might transmit COVID-19 to each other. So it's good to think about, even if you're going to infect each other, it's good to get vaccinated so that you don't make each other really severely sick. So there should be a chance to bring in some of those concerns and make it a well-rounded article full of positive sort of information on the benefits of taking the COVID-19 vaccine. Whether you're planning a child or not, or whether you're planning to have a sexual contact with somebody or not. And I think it's important to quote people who are, doctors dealing with, erectile dysfunction, bring in a quote or two from them, bring in good data from studies and throw that in as well, and keep the tone of the article very gentle, because this is a huge preoccupation. A male preoccupation, it's a source of deep worry and concern, which affects self-esteem. So it'll be good to bring in a psychologist as well, a psychiatrist into the conversation perhaps, and talk about why these unnecessary fears about vaccination could adversely affect sexual performance as well. So you can pepper it up, make it really nice, and infuse it with good sound public health information that can help him make an informed choice about COVID-19 vaccines. But my fellow panelists, please add on to this or improve it, please.
Maybe I can throw in a couple of questions before we wrap. These are concerns from Uganda. Waswa, Ugandan journalist, is saying that the government of Uganda had planned to immunize school-going children. And then because of all the rumors that have been going through, the parents are afraid of the impact the vaccine might have on the children, and some of them refused the children to get vaccinated. How do you approach this, and what's the situation? And also another concern still from Uganda, this journalist notes that a lot of older generation getting lung diseases after the vaccination. What's the situation, Dr. Oni? And finally, there's Daniel who asks if we will share the slide. Yes, we will share the slide and the recording. Thank you.
Only if he promises not to make those rumors headlines and leads.
Exactly.
Absolutely.
So who did you want to address these questions?
Both Jaya.
You end up blowing it, and sensationalizing it. So it's important that we are a bit circumspect with regards to how we handle misinformation and disinformation with the public. Tole, I didn't exactly get your question on the lung disease. Could you please kindly go over?
A lot of the older population is getting lung disease after vaccination, and the other one is what's the situation with regards to children and the vaccine?
Thank you. So it brings me to the first point, which we had previously made earlier. I spoke about it. Sylvia touched on it, and Jaya also, it resonated in the discussions that she had. With regards to looking at the evidence, it's important that we are guided by the data. And when the data is not clear, we're upfront in saying, research is still ongoing with regards to this. With regards to lung disease and the COVID-19 vaccines, there is no relationship between the COVID-19 vaccines and lung disease. And it goes back again to being able to authenticate the source of your information. And like Jaya mentioned, there is the WHO website, there is UNICEF website, and there are tons of literature, that provide guidance on these particular issues that we're talking about. So again, to everyone, it's important that when you hear an information, you go back to the evidence, and if you're not clear, there are open lines of communication where we can clarify. And again, thank you, Wayne, for the opportunity to, to use this as a forum, to educate everyone. The other point I wanted to really touch a bit on is, when Jaya was speaking, there was this question about how do you know that the source is authentic? So, like she mentioned, there are close family people who talk to you and they tell you, oh, COVID-19 vaccines do this. And, there are trust relationships that have been built with those people. And it's very easy to believe them because of the trust relationship. But what is critical to ask is, are they the institutional body, for the evidence? Number one. Number two is, are they experts? And it's important that we are able to critique the information that we have through these lenses. And when we are not clear, go back to the websites we're talking about, and you would find all the reliable information that you need on that. Thank you, Tole.
Thank you, Dr. Jaya. Before we send it back to Wayne, anything to add on?
Yeah, I think I've been talking too much, but it's just that I'm passionate about this. And this is such an important issue. I just wanted to sort of put things in context that if you look at the countries of the Eastern and Southern African region, I do realize there are people from other regions as well here. But if you're looking at how many people have been fully vaccinated, what the coverage is like, we're talking at around 39% on average who've been fully vaccinated. And testing has gone down. People may be doing home tests, or you don't go for a test. If you don't test, you don't know what the numbers of infection might be in your household, in your community. And if you're pregnant or planning pregnancy, or if you're a breastfeeding mom, it's a good idea to get tested. It's a good idea to go and get vaccinated as soon as possible, so that you stay safe, you protect your husband, and you protect your child as well. I think these are some key pieces of public health information that really need to go out. And journalists who are in countries where the vaccination coverage, fully vaccinated coverage, is as low as 20%, which is the case in some countries, need to really rev up momentum to report about these concerns and how important it is for people in the reproductive age group to get the vaccine, and share with them all the safety data and the benefits of doing that, not pushing them to do this or that, but giving them enough information to make an informed choice about vaccination, to make a really thought out, free choice about vaccination. So if we try to sort of adopt too strident a tone in our articles, or throw government recommendations at them, then again, we'll be eroding our trust as journalists, as an objective, sort of purveyor of information. So our job is to collect the best possible evidence, talk to experts from the field and counter-check the data, and lay it all out on the table in front of our audiences in as sensitive and respectful a manner as possible, so that they can make up their own minds. So I think that's our role, and it stops with that. And then it's up to the WHO and UNICEF to sort of pick it up from there and use our articles to sort of support their own advocacy campaigns, and to address also some crises. Like, for instance, in Brazil, a pregnant woman who got vaccinated actually went in for an adverse event. So how do you handle a crisis like that? I think this is a really key thing we haven't covered. But it's very important not to blow it up in the media like a one case out of a million, but it still makes news if it hits the local news, and then it gets sort of picked up by the national media. So I request Dr. Oni to sort of like, how would the WHO handle an adverse event which is getting very, very adverse media publicity when a pregnant woman either dies or has a really serious turn of illness soon after getting the vaccine, which may not be related to the vaccine at all, as it turned out. But how would you suggest that a journalist, who should the journalist talk to? who should the person interview and whose voice and what sort of an information should the journalist give to the press in his articles?
Thank you, Jaya. Really excellent question and very pertinent as well. So in every country, there is the Adverse Event Following Immunization Committee, or, the highest policymaking body is the NEC, which is the National Expert Committee on Vaccine Safety. And they work closely with the NRA, and in every community that you are in, there is a health worker that is trained on managing adverse events, following immunization. If there is an AEFI, what we call AEFI in your community, the first point of call is the health facility, where a trained health worker will talk to you because she has been trained on how to manage the AEFI and would help you to understand if it's an actual AEFI, if it's coincidental, or to classify what that AEFI is about. If it escalates beyond the community, at each of the levels, at district, at regional, and even at national levels, there are constituted authorities that manage adverse events, following immunization. And for journalists as well, they are actually not left out. So when we have new vaccine introductions, for example, the COVID-19 vaccinations, one of the things that we support countries to do is not just to train health workers, but also to train journalists, because it's important that they are able to curate the right kind of information and report it accordingly. So in many countries, there are journalists that cover the health desks, who have been provided with significant training to understand how to report an AEFI and how to manage that. And if there are areas of that are not clear, like I mentioned, within the government, within the Ministry of Health, there is a department, that is responsible for addressing concerns on that. Over from me.
Thank you very much. Unfortunately, we've run out of time for today. Our hour goes so quickly. But as we prepare to wrap up another media dialogue, I'd like you to know we have recorded this talk, and so we will be sending a link to this recording to everybody who has joined the call today. And for the journalists on this call, we really would love to hear from you, to get feedback from you on how these dialogues are working for you, how we can make them better. And we'd also like to see samples of the work that you do in your COVID-19 coverage to give us an idea of how you are tackling all these difficult issues covering the pandemic. Many thanks to Dr. Atuhebwe Aluta, and to Dr. Jaya Shreedhar and Sylvia Samariva of UNICEF for joining us today. And I want to give everyone here a heads up that we are holding a special media dialogue in just 7 days from now on the Ebola outbreak in the region. And normally we come to you once a month with our media dialogues, but because this is such an emergency situation, we are having a dialogue on the subject of Ebola on October 5th, Wednesday, October 5th at the same hour. So we will be sending out notification of that and invitations to everyone. And I think that's one that you will want to attend to get the latest information from WHO. And we'll send you the details in the coming days. So please hold on for that. Until then, for Tole Nayata and the RCCE Media Working Group, I'm Wayne Sharp saying thanks for joining us and stay safe.
Thank you.
Thanks, everyone.